First lecture today is going to be a joint with Steve Shafer and Stewart Cohen. And Steve Shafer, sitting on the right, is a professor of anesthesiology at Stanford University. Our second speaker today is going to be Stewart Cohen. Whether in the courtroom or the community, Stewart Cohen has worked relentlessly as a trial lawyer on behalf of his clients for over 30 years.
What we have here is, with respect to informed consent, is a failure to communicate. And all of the medical literature confirms that even though systematic informed consent is required in all 50 states to be performed by providers, patient comprehension is still lacking. What we have here is a failure to communicate. What we're going to do here, and I'm going to turn the program over to my colleague here, Dr. Shafer, is some case studies, and we're all going to work on it together. Shall we?
I'm not sure how you folks approach informed consent. No matter how busy the day is, I always sit down, grab a chair, and sit down and talk to the patient. How many of you always sit down to talk to the patient? And the other interesting thing is, I ask obviously, every patient gets asked, do you have questions? The vast majority of patients have no questions. So I explain a little bit about what's coming up. I think that falls short because I'm not offering them alternatives, but I really do not expect the patient to decide whether they want Xanax or midazolam. Our first case is pretty straightforward. It's a 3-year-old child requiring sedation for a lumbar puncture.
The pediatric hospitalist is going to be the attending on record, supervising a resident who's going to be doing the sedation for the lumbar puncture done by a separate proceduralist.
Okay, so I'm the mom, and what's going on?
Well, my name is Dr. Carlson. This is Dr. Arya will be working with me today.
Hi, Stephanie.
We'll be providing the sedation. I'll let Dr. Arya tell you what's gonna happen.
All right, so for your child today, we will be providing sedation. So what that is we'll be administering medications, preferably through an IV. That might be through the hand, possibly through the elbow, or wherever we can get access.
She doesn't, I'll tell you right now, she doesn't like IVs. We've had this.
Well, Dr. Arya is new with this, but I'll be there also. But we have a team that will come, and I think the IV sedation is the best.
Dr. Carlson, what was the name of your resident?
Dr. Arya was the resident that day.
And was Dr. Arya in the room the entire time that you talked to the parent?
We did she had some independent things, but during the time we were talking about the procedure, we did that together.
Okay, I repeat my question. Did you offer to do the procedure instead of the resident? Yes or no?
I did not offer that directly.
But the discussion that took place and whether there was ever a direct question, is it okay with you if the resident does the procedure, wasn't asked. And so at the end of the day, the trial is going to be all about that little tiny piece of testimony.
Okay. Okay. So we need a volunteer who's going to be willing to be a dentist who's going to be giving oral sedation and doing the procedure.
So the situation is, the scenario is this. It's a 17-year-old healthy boy for a third molar extraction under moderate sedation, and you will be providing the sedation. And the only medical history is that the patient has wisdom teeth in situ. So plan, I guess, is for oral midazolam and hydroxyzine. Hi, I'm Steve. I'm here with my dad. Nice to meet you.
Hi, I'm Dr. Yun.
Nice to meet you. So can you tell my dad and me what's going on here?
Well, it appears that you need your wisdom teeth extracted. Most patients prefer to have some form of sedation, and we can safely provide you a form of sedation orally so that you're more comfortable during the procedure.
Right. Do I take it that morning?
Yes, you would take it that morning. It typically takes about 30 minutes to take effect. And you'll be awake and conscious the entire time, breathing on your own, but you'll be in a much more relaxed state. And it'll make the whole process much smoother and more pleasant for you.
All right. Dad, what do you think? I mean, this is your routine, right?
This is our standard practice. We can do this without any sedation at all. But again, most patients, especially teenagers, would prefer to have some form of sedation for this procedure.
I mean, there's like a floor plan and all kinds of stuff. It's fine. I'll just sign off here.
Okay, very good.
Doctor,
Yes.
when did you discover that he was the stepfather, not the real father?
I was not aware that he was the stepfather.
And who did you have sign the consent form?
The stepfather.
What would you have done had you known it was the stepfather?
I would have asked more specifically if he had the legal authority to sign for his son's treatment.